Parents will often ask me, how do you actually test for a learning disorder? And what's the difference between dyslexia, dysgraphia, and ADHD? Hi, I'm Dr. James Thatcher. I'm a licensed psychologist. I work at Forest Psychological Clinic in Portland, Oregon, and I've done over 2,000 evaluations, and a number of those are looking at learning disorders or academic evaluations and attentional differences. And by the end of this video, you're going to know how psychologists identify a learning disorder in someone, the different tools that they use in order to diagnose a learning disorder, and I'm going to give you a step-by-step guide on what to do with that information. So once you get a diagnosis, how do you use it to get your child the support that they need? And learning disorders are far more common than what many people think. So where they occur anywhere from 5 to 15% of the time in students in the US. So if your child is having difficulty learning, you're not alone. So before we really dive into this video and I get into the different learning disorders and how we diagnose them, I want to address a myth really quick, right? A lot of people will think, well, the reason that they're struggling so much in school is because they're lazy. They're just not putting in the work. But that's not true. What a learning disorder is how the brain processes information, how it processes written information, numerical information, and spatial information. And it's only when we're able to really understand that and understand those differences are we able to help and get them the tools that they need in order to start learning. So what is a learning disorder? A specific learning disorder, according to the DSM-5 TR, is a difference in how the brain processes information, specifically when it comes to reading, writing, and math. And there's three main types of a learning disorder. You've got dyslexia, which is reading and decoding words. You've got dysgraphia, which is written expression. And the third is dyscalculia, or understanding math concepts and facts. And all of these issues, all these learning disorders can overlap with ADHD and autism. So that's why getting a comprehensive evaluation is going to give us a really good idea on what exactly is going on and give us a full picture on what's happening with your child. So now let's really get into how do we test for a learning disorder and why do these different tests matter? So before testing day even begins, so right after the initial consult, this is what I do. I'm going to give you the process that I use when I give an academic test. Is I'm going to send out measures beforehand. I'm going to send out two different measures specifically. I'm going to send out an adaptive behavior measure. So that's going to be looking at their social skills, self-direction, academic abilities. I'm going to have the parent fill that out. And sometimes I'll even have the teacher fill that out as well. But one thing that I'll definitely have the teacher fill out is called the BASC. That's a behavioral assessment. And they're getting ready to come out with the 4th edition. Right now, while I'm filming this, this is November 2025. But here in December, they should come out with the 4th edition. So it'll have way more research behind it. And it'll be up to date when it comes to its norms. So anyway, sorry for nerding out on you. Basically, what the BASC does, whether you use edition 3 or edition number 4, is that it looks for behavioral and emotional concerns that are happening. It's going to be looking at anxiety, depression, but it's also going to be looking at inattention, concentration abilities, attitude towards school, any social withdrawal. What's happening? And I'll give one not just to the parent, but also to the teacher, because I want to see what their input is. What's going on behaviorally and emotionally for the child. So then on the day of the evaluation, when the family and the kid actually come in, I'm going to be looking at a number of things, and I'm going to use a number of tools. One of the tools that I'm going to use is typically a cognitive test. And one that I use quite often is called the WISC. It's a Wechsler Intelligence Scale for Children. Right now, we're at edition number 5, but pretty soon they're coming out with the 6th edition. So that'll be really fun. And what these cognitive tests look for is verbal comprehension, spatial abilities, fluid reasoning, working memory, processing speed. And what all those do is it gives me clues in how they're thinking and how they're taking in information, how they're processing that information, and has built in executive functioning scales that look at issues related to autism, like working memory and processing speed. And when you take all of that information together, it can give you what's called an FSIQ, or a full scale IQ. And another test that we'll use that day in order to determine if there's a learning disorder is an academic test. And one that I typically like to use is what's called the WIAT, Wechsler Individual Achievement Test. And we're on the edition 4. And with this, we're looking at their reading abilities, their writing abilities, and their math abilities. And then after we're able to calculate all of those scores, we take that and we compare it against their full scale IQ, against their cognitive abilities. So if a child's reasoning abilities, if their cognitive abilities are above average, say a standard score of 110, but then their reading abilities is below average, say a standard score of 80, well, that's enough of a difference in order to diagnose a learning disorder. And I do want to point out that a lot of school systems consider 1.5 standard deviation difference to be enough for a learning disorder. So if you're just looking at standard scores, that's about a 20 to 22 point difference between these different scores, between the overall cognitive abilities or reasoning abilities and their academic abilities, be that in reading, writing, or math. I would also like to point out that the DSM no longer requires that there be a significant difference in these various abilities in order to diagnose a specific learning disorder. Rather, what it's looking for is impact. How impactful, how impairing is their learning? So it's no longer looking for an IQ and an achievement gap. Rather, what matters is that standard tests are showing that there's a significant difference, that there's a significant deficit in their abilities, and that they're below what's expected for their age. And that we can see real world impact while they're at school. So, is it affecting them or not? So if a teacher is reporting that there's a lot of reading difficulties for them, if they're not comprehending it, or if they're not turning in their assignments, that's a pretty big red flag. And then if you get testing, and if testing confirms that they have a below average performance, then that combination is telling us that it's a true learning disorder. And it's not just an attention issue or that they're being lazy. And another test that we may use that day is to look at executive functioning. It's called the D-KEFS. And that's going to be looking at not just attention and concentration, but organizational abilities, different planning strategies, cognitive flexibility. And these are some skills that can often influence a person's learning. So now what do you do if you suspect that there is a learning disorder? Let me give you a simple 3-step guide. Number 1, talk to the teacher. You're going to get examples. Get more information from them. Understand the facts. What's going on for them? What's their behavior in the classroom? What are their grades like? What's their concentration level like? Are they turning things in? Are they able to organize these things? These observations that only the teacher can really give are going to be key in being able to give context to what's really happening. Step number 2, get a comprehensive evaluation. So getting a comprehensive evaluation is not just going to be looking at a learning disorder, but looking at everything else. So it would also be looking at possible ADHD. Maybe that has something to do with what's going on. Maybe it could be a learning disorder and ADHD. Maybe it's just ADHD. Maybe it's not ADHD at all, and it's a learning disorder. If you're having trouble reading, but you're able to concentrate in other aspects of your life, maybe it's just dyslexia. Maybe that's what's going on. So having a really good diagnostician or an evaluator that knows the difference between these things is going to be key. And then on top of that, a comprehensive evaluation is going to give you a really good idea on their cognitive ability, their academic ability, but also emotionally and behaviorally, like what's exactly going on with them so they can give you a full picture. And I do want to make a note that a comprehensive evaluation is going to be different than what the school will offer you. The school is mainly going to focus on one particular issue and just look at that. They typically don't take into account or don't also look at emotional and behavioral concerns that might be going on top of everything. So they might just give a couple of academic exams to look at what's going on and be able to diagnose a learning disorder. Actually, that was a misnomer. I misspoke. They're not able to diagnose anything. They're able to designate that there's a learning disorder. That's the difference. When you get a private comprehensive evaluation, that's a medical diagnosis. This is going to be able to follow them, not just at school, but if they were to change school systems, to their job, going to college. It's a medical diagnosis, so it carries more weight. And number 3 is collaborate on supports. So using this information to get them the extra support that they need. So maybe that's getting them a 504 plan at school. Maybe that's getting them an IEP or an individualized education plan. Maybe that's getting them specific tutoring so that they get one-on-one tutoring on what their learning disorder or what their learning difficulties are, so they can start to learn at their pace and have someone that can view them through that lens so they can meet them where they're at and be able to start teaching them the skills and different methods on how to view this information differently that their mind can understand. When parents finally understand why their child has been struggling, something shifts. Confusion about what's been happening can turn into clarity. The shame that a child feels about going to school, about learning, can start to shift into confidence because now they can get the extra help that they need in order to finally understand these different topics, these different subjects. And I've seen a lot of kids and teens go from hating math and hating reading into not just becoming really good at it, but enjoying it. So I want to give you a personal story where when I was younger, I hated reading. I was awful at it. And why did I hate it? Because I saw everybody else around me in elementary school being able to read these really complex books for, someone in first, second grade. They were complex to me. I couldn't get it. I didn't know how to read that well. More than likely, I grew up in a very rural area, so there really wasn't a ton of testing around. And we're talking about like the early 90s. More than likely, I had, or still have, a learning disorder in reading. And I don't know how my mom did it. I guess intuitively, she just kind of knew. And she would spend about half an hour, so not too long, so I could sit down, I could concentrate, and I could go and do it with her on learning words. She intuitively knew that it was the phonics of words that was difficult for me. And she spent months teaching me that. Months. And every night I would have to practice and read out loud. She'd be cleaning and I would read to her, and that's how we did it. So she was my tutor, and I can't thank her enough because if it wasn't for her, I wouldn't be where I am today. So I want to end with this, to where every child learns differently, and that difference deserves to be understood, not judged. And when we understand a child's learning profile, how they view the world, how they take in information, well, then we give them permission and we give them the tools that they need in order to start learning and in order to start enjoying what they're learning. And that can change everything. All right, so if you like this video, go ahead and check this video out. I hope that you like it, and I'll see you there. All right, bye-bye.